When brain surgery is necessary for a patient's treatment, how does the surgeon know exactly where to operate? Brain mapping assists the surgeon to pinpoint the problem. Dr. Richard Kim of Hoag Memorial Hospital Presbyterian in Newport Beach discusses the vital role of advanced brain mapping.
Brain mapping refers to localizing the critical functions of the brain. And the reason that's important is because, first of all, brain functions are not distributed all over the brain. The primary functions, such as movement and language, are localized in very discrete areas of the brain with patches in between that don't have those primary functions. And so for things like brain surgery, it's important to know where the boundaries of those primary areas are. And second, the surface of the brain looks the same everywhere. And so one can't locate a functional area by how it looks, and so it has to be mapped out in some way. Brain mapping is critically important for some brain surgeries. For example, removing a tumor close to an important area such as motor or speech, or removing a zone of epilepsy to try and cure a patient's seizures. And so it's important to map out not only the pathology, such as the tumor, where it is, where its boundaries are. It's important to map out the boundary of the primary motor area so that you don't encroach on it and cause paralysis, or the speech area and cause problem speaking.
We asked Dr. Kim whether brain mapping is used in all brain surgery cases.
Not all brain surgery. There are large areas of brain in between the primary areas in which surgery can be done safely without producing an obvious neurologic side effect. And so for those cases, it's usually pretty apparent on the MRI scan whether you're far enough away from a primary area so that mapping techniques aren't necessary. We have developed the brain mapping program at Hoag over a period of time, and that development has included the technical side in terms of equipment, the preoperative imaging, and it's included the patient experience and the surgical expertise. And so at Hoag, we have all of the elements in place for whatever advanced brain mapping may be required for any kind of advanced brain surgery. There is a sophisticated team, and they all fall under the umbrella of the Neuroscience Center of Excellence at Hoag Hospital. And that encompasses all the various programs within neuroscience: epilepsy, brain tumors, vascular, and others. And when those surgical procedures require brain mapping, then that surgeon who may have a particular expertise in that area of surgery also needs to be able to apply those brain mapping techniques. It's because of the volume and complexity of our brain tumor program and our epilepsy program and our vascular program that we have to have these brain mapping techniques to apply to these patients.